This morning, ER doctors are asking, where are the patients?
We're seeing real, legitimate emergency patients delaying care of coming in because of the fear of catching COVID.
Stacy Simpson is one of those patients. She's battled heart disease for 15 years, but a recent scare in the emergency room has her afraid to go back.
I'm thinking, okay, I'm having a heart attack. And now I've been exposed to COVID essentially by being in this room. And it really made me feel like, I'm going to die.
A survey from the American College of Emergency Physicians found that nearly a third of American adults say they've delayed or avoided medical care because they're concerned about contracting coronavirus. At the peak of the virus, Ascension Health Systems, with 150 hospitals in 20 states, says patient visits to the ER were down 48%. Doctors say that can be deadly.
So we've seen heart attacks and strokes and surgical issues that would have been a relatively benign procedure or something that we could have acted on that are coming in too late for us to do much with it.
One cardiac physician says some patients are coming in critically ill because they've delayed needed visits.
There's a lot of patients who are basically dead on arrival by paramedics because they've waited too long.
Master, what's the address of the emergency?
But now, with new safety protocols in place at hospitals around the country, doctors stress the danger of an untreated heart attack or stroke is much greater than the risk of catching COVID-19 in the hospital.
You are much more likely to die of a cardiac issue without appropriate medical care than you are to die of the coronavirus at this point.
And Carrie joins me now from outside a hospital in Fort Lauderdale, Florida. Carrie, you spoke with the doctor at that hospital who said patients are basically dead on arrival because they are simply waiting too long to call 911. How on earth are hospitals trying to convince people that it is safe to go to the emergency room?
Well, Dr. Osmond here at Broward Health in Fort Lauderdale, as well as the first responders, are trying to get the word out to people to understand that when they arrive at a hospital, in an emergency room like this, that their perceptions are wrong. The misperception is that the hospital ambulance arrives here, you're taken out on a stretcher, and you go through what people believe is like a cloud of coronavirus that somehow may infect them. But in emergency rooms here and across the nation, they have separated as people come in. So coronavirus patients are isolated over here. Others are taken over here, so there's no cross-contamination. But a lot of it is because initially, when this first happened, especially back in the early days of March, hospitals were encouraging people to perhaps delay going to the hospital. They weren't talking about emergencies. They were talking about elective surgeries. But as you can imagine, people get confused. And, Allison, there is a real fear. Nobody wants to get exposed to the virus. But as the doctors say, that's not the case here.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.